Greetings on the occasion of the World Stroke Day. Today we are dedicating this day for celebrating and also to bring awareness on the occasion of the World Stroke Day. Friends, as we all know, brain is a very, very important organ, and it is the second common cause of morbidity and mortality is stroke. So stroke is caused either by blockage of a blood vessel supplying the brain, and the blood supply, when it gets cut off, the stroke happens, and it is reversible in many instances provided patient reaches the hospital in time within the golden hour or two. Second common cause of stroke is due to bleed or hemorrhage inside the brain. This often happens because of hypertension or because of conditions called as aneurysm.
What the general public or the patient needs to watch out for are the main symptoms of stroke, which is popularized by the acronym FAST. That is facial weakness, arm or limb weakness, or speech difficulty. And the most important thing is T, which is time. Time is brain. You need to get the treatment as quickly and as fast as possible.
Now in Fortis Bangalore, we have moved further and considered the concept of fast test. So what is fast test? Fast, we all know. What is E? E means emergency room. The patient has to be immediately moved to the emergency room. S means scanning. The patient has to be immediately considered for a scan, either a CT scan or an MRI, dependent on the doctor's discretion. And T means treatment. So the treatment is either the thrombolysis, which I just told about, or it could be further the thrombectomy, which is the other next higher order of treatment for acute ischemic stroke.
Now, acute stroke, as we know, is one of the dreaded neurological emergencies, which happens when a portion of your brain does not get blood. Now, there are two types of stroke. One is an ischemic stroke, where a portion of brain, the blood supply to that portion of the brain is blocked, and the other is a hemorrhagic stroke, where because of bleeding, that part of the brain is not getting blood. Now, coming to ischemic stroke, the treatment of ischemic stroke has made vast strides in the last few years. Interventional radiologists and interventional neuroradiologists have a huge role to play in the treatment of acute stroke. With each minute of stoppage of blood supply to the brain, about 3 million neurons die every minute. So what is vital is the blood supply to the brain needs to be restored. So interventional radiologists and interventional neuroradiologists are able to enter these brain vessels through small pinhole incisions in the groin of the patient or in the hand of the patient. And if in time we are able to reach the clot and pull the clot out through advanced instruments known as stent retrievers and aspiration catheters, the blood supply to the brain gets restored. What is vital is to understand that time is brain. The treatment has to happen fast and the treatment has to be quick.
What is important for stroke treatment is you have a time frame to treat such stroke patients. If you go to a place where there are stroke ready hospitals, Fortis Hospital provides a state-of-the-art facility for stroke treatment, where we have a CT, MRI round the clock. Once there is a patient comes to an emergency with the stroke symptoms, we do CT scan or MRI in few minutes, and we take a call whether to give a clot buster medications or not.
In case anyone of you do come across a patient who may be suspected of having stroke, there is no need to panic. All you have to do is reach a hospital, an emergency ward, which is fully equipped with a lab like this, and the doctors there can take care of it if provided we come in time.